Two. Well, welcome back, everyone. So we had to take a little bit of an intercession. So we're talking with Miss Adrianne Coward with Monarch Patient Advocates, and what we're gonna go into now is her services, or some of her top three services, because it's a plethora of services that she offers. So, Adrianne, let's start talking about some of your services, your top three.
Absolutely. My top three would be I like to go to doctor's appointments with my clients.
Mhm.
So I attend those with them since a lot of times they don't have family in the
Right.
area. So I'll
Mhm.
do that. I also do medication management,
Yeah.
helping them manage their medicines. And I also do a medical binder for my clients as well. Yes.
Wonderful. So all those are very major important services, because
Yeah.
we get the questions all the time about what are your services, and it's really client specific, but those top
Hmm.
three are huge. So let's talk
Right.
about the doctor's visit. So how do you feel that the doctor's visit is different from when a nurse advocate attends that visit?
I can feel a difference in the room. I have actually had clients tell me that they've noticed a difference as far as how the doctor approaches them with me being there. I think we had talked about at one time how it's a collaborative type of
Right, right.
connection that we have with the doctor. So, is my goal is so that we make sure we're taking care of the client. That's
Ab-
the main goal. And
Absolutely.
and for the clients, it brings them peace also too, because I know what questions to ask when they don't know what to ask, or to improve their health outcome. So it's just, and then I take notes. I
Mhm.
actually use I don't know if I can say this on here, but I use a device, an app called MedQuarter,
Mhm.
and it records the entire doctor's appointment. And so then I can invite family members to the room and they can hear the entire conversation
That's
of what
awesome.
occurred.
That's
Yeah, I love
awesome.
it.
That's
I
awesome.
love it, because
Yeah.
like I have one client now, her son is in another state. So I
Mm-hmm.
go with her to the appointments and then
Mm-hmm.
record it, and then he can go in and hear the whole entire conversation.
Absolutely. Because I had a
Yeah.
conversation with one of the healthcare home health companies that I usually network with, or
Uh-huh.
whatever. And they were saying, yeah, our caregivers go to the doctor's visits with our patients, and
Hmm.
they take notes. And I'm like, that's great. But what type of notes? And then
Right.
how are they implementing what they took? And are they really setting goals with the clients? And that's one thing
Hmm.
that happens at the
Hmm.
doctor's visits when you have a patient advocate with you. Now, I will
Hmm.
say this: I'm partial to nurses, but
Yes.
all patient advocates are great, but they're not
Yes.
created equal. Okay.
No, they're not.
So
No.
I'll just say that, it's the type of notes that you take and what you do with those notes. So
Yes.
having an advocate by your side is key, because I've seen the difference in
Hmm.
um, or the outcomes. That's
Absolutely.
outcomes
Yeah.
in doctors' visits.
Hmm.
It's about
Hmm.
collaboration.
Absolutely. Yes.
Yeah. So the other thing you talked about was that medical binder.
Oh, yes. Music to your ears.
Yes, I love it. I love it. So I know before you were talking about, helping people navigate with that medical binder. So give me
Uh-huh.
an example of how you've used the medical binder.
Yeah. Well, I like to, once I put it together, I make sure that the client brings it to every doctor's appointment that we go to, and have those vital notes that are pertinent to that appointment too. So I don't want us to be so overwhelmingly bulky that because the doctor's not going to sit there and look through it anyway,
Mhm.
for a lot of it. But the most
Mhm.
important vital things where they should know what the other doctors are talking about, I think should be in there as well. Because I
Super
mean,
key.
yeah, because the electronic health record systems that we have in place, not every doctor is connected to it. I'm already, you
Oh,
see
you know
that.
what? That's true. I found that out
Yeah.
today.
Okay.
Because the physician that we went to, they had something totally different
Mm-hmm.
than the main one. So I was like, oh, wow. So
Uh-huh.
you're right. And then what about the millions of people who don't have access to the internet?
Absolutely. And that's a lot of people. And a
Right.
lot of elderly people don't have
Mm-hmm.
any interest
Mm-hmm.
in being on
Mm-hmm.
anything electronic either.
Well,
My
look at,
dad still has a flip phone.
right,
Okay.
right, right. Yeah. Half of my clients still have a flip phone. And
Right.
so I just take my laptop and if we have to do something electronically or have a virtual visit, I just take it to
Mm-hmm.
them. That's the service that
Right.
we provide because it's so unfair.
It is
Um, you
unfair. Yeah.
know, and I just think that you shouldn't have to do something that you don't want to do, and you still
Yeah.
should get adequate access to care.
True. I totally agree with that. Yeah.
Yeah, yeah. And the big one, medication management.
Oh, yeah. That's a doozy. Let me tell you, it is.
Mhm.
I'm finding that a lot of people, it's just hard, especially elderly people. It's hard to keep up with all the changes that go on with their medications and things. And just, it can be overwhelming too, is another
Mhm.
thing. So,
Right.
just, like my last client here that just got out of rehab, I had to connect with the nurse at the assisted living facility because they were not reordering her medicines on time. So it was a bit of a mess. And so we actually sat down and physically went over the meds, cleaned up
Good for
discarded the one
you.
she's no longer taking. She updated her medication administration record based off of what I have. I put the medication list in my client's room so she could see what it is. And yeah, just to bring her that
And
understanding that somebody is
right.
making sure this is taken care of.
And she probably was so grateful for that because
Yeah.
I've worked in one of those. It was an Alzheimer's unit,
Okay.
and ooh,
Yeah. Yeah.
you're the only nurse with 20 patients, sometimes 16 to
Yikes.
20 patients.
Yeah. That's
And
crazy.
just think that everybody at least had a minimum of 8 meds.
Wow.
So that service right there,
Mm-hmm.
and I'm going to be partial and boastful and everything, and say some of those assisted livings need to hire some of us to come
Yeah,
in
they
and
do.
just do that and help that nurse out because it's
Mm-hmm.
overwhelming. It's very
Yeah.
overwhelming. And being on that side of the nurses
Mm-hmm.
station,
Mm-hmm.
not easy.
Yeah, I can see that because I think she has
Mhm.
like 40 clients,
Ooh,
40. And Monday, Wednesday, Friday, she's only there.
wow.
But yeah, I was just like, no, this needs to get cleaned up.
And the
Let's do it. Let's
and the
get it sit
system
together.
just doesn't get it. That's too many
No,
patients per one nurse. That's just
I think so.
ridiculous. Oh my
I think
goodness.
so too.
But that's
Yeah.
another podcast.
Yes,
It's
it
like,
is.
whoa, that burns my butt.
I agree.
Because
It
yes,
is
because
that
how
is a
can they
lot.
give adequate care? It's no way. And
No.
then as a nurse, you have when you give a medication, you need to
Mhm.
see what the outcome was of that.
Yeah,
When you're
that's
doing
true.
that, you don't have time.
No, you don't. You absolutely do not. Like you had said before too, I think we were talking offline. You were saying how medications change in the color of what they look like, the shape and
Absolutely.
all that.
Yes, yes. So I
Yeah.
had a
So,
client, I was helping her go over her medication box because it's all about teaching, right?
uh-huh.
And we noticed that her one of her medications was pink at
Mm-hmm.
the last order. This time it was white. So you
Wow.
can't go by, oh, I take a white one and a blue one and a pink one and a yellow
Mm-hmm.
one, and this one's round. And because the pharmacies, not no fault of theirs, but they change up the way the pills look. So you can't go
Yeah,
by that. You really have to be very cognizant and very careful of what's in
mhm.
that pill box. So it's more
I
than just a
totally agree.
medication box, right?
Yeah,
And so
absolutely. Totally agree. Yeah.
and staying on top of ordering them because all your
Right.
medications are not going to be not run out at the same time, so to
Nope.
speak, right?
No, absolutely.
And then all your
Yeah.
medications can't be delivered. So if they're
Yeah.
narcotics, they can't be delivered.
They
So
cannot. No. So
it's very
yeah,
key to have somebody on top of that all the
I,
time.
I think so too. I think so too. So
And
yeah.
then we had also mentioned that, some people have been taking a regimen of medications for years
Hmm.
and nobody's monitoring that.
Nope.
How do you know those medications are still working?
That's right.
Right?
Absolutely.
So,
Vitally important. Yeah.
yeah, because you could be
Yeah.
taking something for years. So, I'll tell you a quick funny story.
Yes.
I'm allergic to Oreo cookies.
Are you really?
I am. I
What?
want to
How
cry.
did you find out about that? That you're allergic to?
So one night, and that's my whole point. You can be doing something for years, and then all of a sudden,
Yeah.
your body says, don't like it,
Uh-huh.
right?
Uh-huh.
So that was the last thing that I had a snack when I
Okay.
went to bed.
Okay.
So when I woke up that morning, I looked like Mike Tyson had got a hold of me. So
Oh
it was like my
no.
face was all swollen up, my eyes were shut. So it's
Wow.
just like, okay. So I don't mess with anything that has an Oreo cookie crust or
Okay.
anything like that. So
Poor thing.
yes, yeah,
I feel so
I
bad for
know.
you. God, girl, that's
But
crazy.
that goes to medications too. You could be
Yeah.
taking something for years,
Mm-hmm.
or the pharmacy could change or tweak one little thing and it interacts with something else.
Yeah.
So having a patient advocate review those medicines, especially when there's a new one added
Yeah.
or one taken away, or
Yeah.
documenting how you're feeling, your vital signs, all
Yeah.
that's key.
Very important. Yeah. It's like my one little client that's at the assisted living, they reduced her blood pressure pill, hydralazine, reduced it. And so I'm saying, okay, has anybody been taking her blood pressure in the assisted living facility? Nope, they had not. So I said, nope, we're going to start taking her blood pressure. I said, they reduced the dosage. We got to make sure it's working, and
Absolutely.
got her blood pressure cuff, showed the CNAs how to do it, how to take it, and a recording book. So now we're
Mm-hmm.
recording it, and
Yeah.
we'll take it to the doctor's appointment when we go, the next time, just to make
And
sure.
that
Yeah.
majorly important medical binder.
Yeah, exactly.
Mm-hmm.
Exactly. Yep.
Mm-hmm.
Hmm.
Right, right.
So,
And then we had even talked about with the medical binder, so many people are pushing digital, digital, digital. But
yeah.
what when you have
Yeah.
three physicians, one of them doesn't use a portal and the other two
Right.
on two different patient portals that are
Right.
not linked together or can't talk to one another. So it's
Hmm.
very confusing.
Absolutely, it is. Yeah,
You know?
definitely. And this is a
Mm-hmm.
way to take care of that. Bring that
Absolutely.
binder, and then they can see what the other doctors. Because I mean, even when I think about today, the other doctors still don't know what other doctors are doing for the clients. I don't
Right,
understand that
right,
even today. And
right,
it's like that
right,
makes no sense to me that you don't realize the rheumatologist over here is telling you to do XYZ. Then you're
right.
over here, doing XY. You have no clue what medicine the person is on. I just don't understand that because I saw that recently.
Oh
That
my goodness. Yeah.
makes
So
no
you
sense.
you hit on a good topic because it's all
Yeah.
about like my client that I have. She has a cardiologist, a neurologist, and a primary
Hmm.
care doctor.
Uh-huh.
So poor primary care doctor, he he is just out of the loop sometimes, because
Yeah.
he needs to be updated because the specialist, they're concerned about their area of expertise,
Hmm. Hmm.
and these physicians, they don't have time to you know maybe have a case conference,
Yes.
right?
Yeah, absolutely.
They don't have time to talk to one another. They're seeing 12, 13, 14, 15 patients a
Hmm.
day.
Right.
They got to move around. So having a patient advocate or nominating someone in your family who can be your patient advocate, it's a
Yep.
big thing. It's a
It-
big to do.
Absolutely. Absolutely it is.
Yeah.
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 So totally agree.
Right. Right. That's why we love what we do.
Yes, me. Yes, we do. Yes, ma'am. Yes.
So
All the way.
I say if you're a veteran, you owe it to yourself to contact my friend Adrianne Coward so she can
Oh,
help
thank you.
you navigate that complicated system. That's a whole other ball of wax separate from the regular hospital system, you think that's
Mhm.
confusing. Really being
Mhm.
a veteran is key to have someone by your side that's going to be
Yeah,
on your side.
absolutely. Totally
Right,
agree.
right,
Yes. For
right.
my own experience of knowing how convoluted, archaic, unnecessarily complicated. That's what I'm going to just put that out there. It is
Right.
unnecessary how complicated it is. I'm
Yeah.
battling that right now to change it because
Yes.
I'm this kind of person. It's like I don't believe in just complaining about stuff. I have solutions as well too, and so,
Yes.
but I have to find the right ear that wants to hear what I'm saying. I got
Absolutely.
to find the right ear. So I'm still pushing for that because the community care section alone is the most confusing, unnecessary system in the world.
Mm.
Just to get service outside of the community when they can't provide it to you at the VA.
Hmm.
By law, they're required to have us go outside. But
Okay.
all of the tunnels and twists you have to go through just to get that consult and get approved, and then you go into the community and then the doctors they send us to are rude and they don't understand, they don't know the system. So I find myself educating because I go in the community, unfortunately, for a lot of things.
Hmm.
And I find myself having to educate them on what to do,
Right.
for me. And now I have it down. Honey, I got the system down.
That's
Boom, boom,
exactly
boom.
why.
I got it down.
That's
So,
exactly why they need to contact you, because it can get so overwhelming
mm-hmm.
and confusing and just stressful,
Yes.
you know. And the paperwork is tremendous.
Mm-hmm. Absolutely.
I
Absolutely.
told one system, I said, "Do y'all not talk to each other?" I said, "This is really frustrating for me, and I kind of know how to navigate, but I said, you guys,
Yeah.
it's the same thing. This department didn't know what this department was doing, and didn't know what that
Uh-huh.
department was doing." It's like, okay, well, let me tell you how it's going to work for me and my client.
Right. Yeah,
Because
there
it's
you
like,
go.
okay, this is ridiculous. So I've already scanned that over to you, so you go ahead and review
Mm-hmm.
that. So
Uh-huh. There
it's
you
like,
go.
it's
Like
like,
minds think alike. Like minds think alike. Yes, girl,
yes,
for sure. And
ma'am.
then when you're not feeling well, you don't have time trying to figure something out. You
Right,
don't feel good, and then you
right,
want me to jump through all these hoops
right,
just so I can be seen on the outside. Yeah.
right.
It's
Mm,
embarrassing what we do to veterans in this country.
it
And
is
I'll say it over
awful.
and over again. People talk a good game, but
Oh my
now
goodness.
I've have some
Hmm.
good doctors at the VA. I'm not going to
Okay.
say they all are um, not good. I guess that's the best word I can say. But
Hmm.
I have some good ones, but I've seen some areas where it could be better. You
Well,
know,
they can improve their lives too by getting a patient advocate on their side.
they sure can.
How
Hey,
about
hey
that?
now. Yes. I like how you segue into that. Yes.
Yes, yes, because it's true. It's true. They're stressed
Uh-huh.
out as well.
Yeah, they
They're
are.
human beings as well. So I have
Uh-huh.
to, go look at both sides of the coin as I get more experience in this life. It's not
Yeah.
just one way to the story, right?
Yes.
It's
True.
like a start, in my opinion. You got, the healthcare system, you got your opinion, you got the doctor's opinion, you got your family,
Mm-hmm.
you got all these other aspects that go into it. So
Mm-hmm.
we as patient advocates, we really can be a very beneficial asset to any
Right.
physician, helping
Yes.
your client
Absolutely.
understand, because you only have a limited amount of time with your
Uh-huh.
patient. So we, after the visit, lots of my clients, we're talking before and we're talking during and we're talking
Mm-hmm.
after, making
Right.
those plans, making sure they understand
Mm-hmm.
what the plan could be 3 months, 6 months, 9 months down the line.
Yeah. Very
So
good.
nobody else has that time to do that, but we do.
That is true. Yeah. Absolutely. And love doing it too. That's the thing about
Absolutely.
it. Yeah.
Yes. And
Uh-huh.
continuous learning. It's continuous learning
Oh my
process.
gosh.
Oh,
Yes.
yes. You want to continue to learn? Be an advocate.
Every day. As my mom says, you should
Yeah.
learn something new every day.
Every day.
I learn something new every day. Trust me and believe
Absolutely.
every day.
Absolutely.
Mm-hmm.
Well, Miss Adrienne, I thank you for your time. So, if
Yes.
someone wanted to get in touch with you to learn more about you, what your services are, because she has a plethora of other services. We just talked about the top three tonight,
Right.
which we really could have included top five, but for the sake of time, how would you prefer someone get in touch with you?
Oh, absolutely. They can call me at 512-662-1764, or you can email me at info@monarchadvocate.com. And that's advocate without an S. And then, hey, just reach out to me and I'll get back with you.
Wonderful. Well, thank you again. Number one, for your service. Number two, for being a nurse.
Thank
Number
you.
three, for being an advocate. And number four, for
Thank
being
you.
such a special person. So
Oh,
thank you
thank
for
you.
your time.
Absolutely, my friend. This was wonderful.
Yes. And
Yes.
thank you, everyone, for tuning in to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. I love bringing you reputable resources from your local communities. Tune in next time for another amazing chat.
All right. Bye, my friend.
Bye.